This morning, Dr. Hopkins is meeting with Deborah Bauer and her husband Bruce for a follow-up exam after Deborah's recent stent and coil procedure for a second aneurysm.
Remember, on the first day, we put that little stent in the artery. That little stent goes from here to here, and it covers the whole neck of the aneurysm.
Okay.
And that was because the aneurysm neck was so wide that we knew the coils would not stay in the aneurysm unless we did something to bolster the coils, hold the coils in place. We put a tiny, tiny catheter up through the hole in the stent, inside the aneurysm, and as we pushed the coil through, we actually started to fill the aneurysm, but then as we pushed more coils through, one of the coils actually popped right through the wall of the aneurysm, which shows how fragile the wall of your aneurysm was and how close you were to having it rupture on its own.
Oh, I see. Okay.
And so the coil popped through the wall of the aneurysm, but fortunately at that point we had control of the aneurysm, number one, and number two, we had the stent in there to channel the blood flow back into the normal artery. And that's why you're still here.
Thank God.
Yeah.
In mid-June, I started getting headaches again. I thought it was really attributed to stress from my job, but they became more frequent and they were actually affecting my eyesight.
When my wife first started encountering the headaches again after her first surgery, we knew that it was something that we had to look into. We thought it might be some complications as a result of the first surgery or the possibility that she may have a second aneurysm.
Deborah Bauer's first aneurysm was found through a yearly checkup after a diagnosis of high blood pressure. The treatment for Deborah's first aneurysm was a traditional craniotomy.
I went back to my neurosurgeon who had done the first aneurysm surgery because I was having headaches again. He ended up doing testing and also then found out that I had another aneurysm. My neurosurgeon was very uncomfortable with going through the skull for the surgery because it was near the brain stem, and the aneurysm was located on the pica artery, which is a very delicate area. So he recommended that we see Dr. Hopkins in Buffalo, who does a stent and coil procedure. Even though it's very scary, you don't have a lot of options. It doesn't make any difference how big an aneurysm is or how small. It has to definitely be taken care of. I think Dr. Hopkins and his team saved my life, and the procedure that went along with it, with the stent and the coils, did also save my life. I feel that everybody should get a regular checkup every year on a regular basis, and I think people need to read their own bodies and know what's going on with their own bodies, and if they are sick, they need to take care of it.
The best prevention of stroke, besides diet and exercise, is a regular physical examination. One unique test for the onset of potential stroke problems is the Doppler carotid artery test. This test shows the potential fatal plaque that can build up in the carotid artery. When the artery becomes severely narrowed by plaque, the risk of stroke greatly increases. Remember, stroke is a medical emergency. The single most important factor in treating a stroke is time. Stroke victims need urgent medical care. Call 911 if you think you or someone else is experiencing a stroke.
It's my father. He's not talking. It doesn't seem like he can. There's something wrong with his right arm. It's like he's having some kind of a seizure.
Remember, most Americans can't identify the symptoms of a stroke, even while they're having one.
I think we're going to go from a period in time, which was 1996, when there was no approved treatment for stroke. Nothing. There are some 700,000 strokes in this country every year. We're going to go from that era to an era where probably most strokes are not going to happen because we're going to figure out how to diagnose them or diagnose the underlying vascular problems and then through minimally invasive approaches fix them so that the stroke doesn't occur. I think more than any other disease, stroke is a disease that will fall in the new millennium, and we're going to be a part of that.